Earlier this morning, we introduced you to a program in Salt Lake County, Utah that allows anyone to walk into a county library and walk out with naloxone. No money required, no questions asked. That's right. The drug can save a life during an opioid overdose, which is why one Utah doctor has made it her mission to get it into the hands of anyone who might need it, for themselves, for a loved one, or for a stranger. 6 on Your Side's Karen Lair has more on how the Utah legislature made it legal for individuals to distribute the drug without a prescription.
The main mission is keep people alive. Nobody can get better if they're dead.
Dr. Jennifer Plum is passionate about getting naloxone into the hands of anyone who may at any time need to reverse an opioid overdose on themselves, a loved one, or even a complete stranger.
A dad who called me recently and had saved his son on Christmas Eve night.
On top of her role as the medical director of Utah Naloxone, Dr. Plum works in the ER at a children's hospital.
One night I had 4 kids under 4 all overdosed on opioids from 4 different homes. State of Utah, we fill 7,000 prescriptions for opioids every single day. We got a lot of kids. Guess what that means? Kids find this stuff.
Utah Naloxone works with a long list of agencies across their state, supplying people with naloxone kits like police officers, librarians, any opioid treatment providers, and so on.
It really is about putting naloxone into somebody's hand. We can talk about it all we want. We can have ads about it all we want. It can be available in every single pharmacy, and that's not the same as putting it directly into people's hands.
So how do they get it into someone's hands without a prescription? Naloxone isn't a controlled substance, but it is a prescription substance that you'd normally have to get from a doctor, pharmacist, or some kind of healthcare professional. That's how it works in Idaho, but in 2016, Utah legislators added verbiage to their law allowing any individual to distribute the drug.
So that could be law enforcement, that could be EMS, that could be someone who works in a treatment center, that could be someone who works with those experiencing homelessness, that could be someone who works in a mental health entity. And we listed all of these, potential folks we thought would be interested, all the way down to individuals.
That made it legal for anyone in the state of Utah to provide naloxone to someone else. Because from Dr. Plum's experience, not everyone has a doctor, and many wouldn't feel comfortable opening up to a pharmacist about addiction.
And I got a phone call last night, 1:30 in the morning, from someone who wants a kit, and they just weren't comfortable with their pharmacy. They weren't comfortable with their doc. They weren't comfortable with the health department. And so they're either going to go to a library, and if they can't get up the kind of gumption to do that, I'll meet them and give them a kit in probably some Maverick parking lot somewhere.
Karen Lair, 6 on Your Side.
Dr. Plum is also making strides to get naloxone into the hands of newly released inmates in Utah. Now, a study came out in North Carolina that shows that particular population is more than 40 times more likely to die of an overdose within 2 weeks of being released. For heroin-specific overdoses, they're 74 times more likely to overdose.
And so Uinta County is the very first in the state of Utah out of jail. The sheriff there, Sheriff Labram, has agreed every single person released from incarceration will be handed a naloxone kit. So it's more about, for us, continuing to develop new strategies to get these kits in people's hands.
Salt Lake County Sheriff Rosie Rivera is also exploring the option of providing released inmates with naloxone, but their department is hesitant to hand out needles to potential addicts, and the nasal spray Narcan is significantly more expensive. We reached out to the Idaho Department of Correction, and although they plan to arm frontline correctional staff with naloxone soon, they're not considering providing naloxone to inmates upon release.